Is cramping normal during pregnancy? My name is Dr. Weng Chan. I'm a fertility specialist in Melbourne IVF, an obstetrician, gynecologist, and a laparoscopic surgeon. There can be a lot of changes that occur during pregnancy, and cramping is one of the results sometimes. Unfortunately, in the majority of cases, this is normal and can be very common. It can occur at different times during the pregnancies or different trimesters. And depending on the situation, depending on the symptoms, they may reflect on different occurrences or changes that occur during the pregnancy. One of the most common concerns and fears I always get with my patients is whether or not this cramping is going to result or is part of a result of a miscarriage occurring. I can understand the fears of patients because every pregnancy is different and they may have had a previous experience where the outcome wasn't as to desired. And in these situations, the fear of something recurring of a pregnancy loss and so on can be very vivid in the patient's mind, and it can play a part in the pregnancy and cause a lot of concerns. Miscarriages occur in 1 in 5 pregnancies, and unfortunately, as mentioned, they are very common. But in the majority of cases, they do not really present just as cramps, but they present more as pains that progress, whereas cramps usually are self-limiting and resolve. With miscarriages also, they can be bleeding. If there's any concerns, my recommendation would be to talk to the obstetrician or gynecologist that is taking care of you during the pregnancy. And it might be as simple as just taking a history, doing an examination, and performing an ultrasound to confirm that things are progressing appropriately and smoothly. Now, sometimes if the pregnancy is very early, this may not necessarily be possible. And the clinician may choose then to have serial tests or investigations to check how the pregnancy is going, and based on these results, tailor things forward. A common presentation of cramps during the pregnancy can be what we call implantation symptoms that occur, and they can present with cramps usually around the 2nd to 4th week of the pregnancy. There can be a small amount of bleeding also in these situations, but as mentioned earlier, these sort of symptoms are usually quite limiting and resolve and get better, whereas a miscarriage, these sort of symptoms tend to progress and escalate further. The most common symptoms that occur or cramps during the pregnancy is usually as a result of the progesterone hormones that support the pregnancy, and this can cause basically the gut motility to slow down, and they may present with bloating, sometimes altered bowel habits, and this presents with low abdominal discomfort or cramps for a lot of patients. The same hormones also that can also cause the gut motility to slow down and the acid in the stomach to basically stay more in the stomach and cause indigestion pains. The muscles that control the acid from going up through our esophagus or gullet can also be relaxed, and as a result cause indigestion pains and cramps up higher above the chest area. Usually these are very benign and they're very quick, easily managed with simple changes to diet, timing of when you eat, trying to avoid spicy foods or limiting the portions of foods to not large amounts, especially before sleep and so on. Another symptoms of cramps that women can get early in the pregnancy also occur as a result of increased blood flow to the womb, and this can also cause lower abdominal discomforts. And as the womb progresses and grows along with the pregnancy and in the journey of the pregnancy, these sort of discomforts can also increase, but again, they're usually very limiting and they resolve with simple measures and simple energies if required. Other common causes of cramps in the pregnancy, aside from the womb growing with the pregnancy, include some ligamentous cramps and pains and discomforts that may occur as a result of the support structures, what we call the round ligaments and so on, being stretched as the pregnancy gets bigger. This tends to present with cramps more on the sides, and it can be associated with more discomfort if someone is moving around. Simple stretching, resting, and sometimes seeing a physiotherapist also can be very useful for these sort of things. The question I suppose most people wonder is, when is this normal? When is this not normal? When should I seek help? And it really depends on the combination of symptoms, but if there's any fears or concerns, then I would suggest that you contact your health provider to discuss the matters further. The common things that we would like to rule out and is quite easily treated, which can occur during the pregnancy that can cause cramps, also includes things like infections in the bladder, 5% of pregnancies can have infections in bladder without any symptoms also, and usually the obstetrician may order a urine test at the start of pregnancy to rule things out. Other symptoms you can get with a urinary tract infection includes a fever, temperature, discomfort with passing urine, sometimes blood in the urine also. As the pregnancy progresses, the body will go through practice runs, what we call Braxton Hicks contractions, and that usually is a painless, self-limiting uterine tightening that occurs. Think of it as a way for the body to prepare for itself to get fit to give birth for the baby at a later stage. Now, as I mentioned, a lot of these symptoms are self-limiting, and if they progress, then it's important to ask the question and seek help from someone just to make sure it's not false labor starting, or if you believe, or if they need to rule out whether or not there's any preterm labor that can occur. Later in the pregnancy also, other things to rule out which are very uncommon but may occur include things like concealed abruptions or separations of the placenta, as well as things like preeclampsia, which usually present with high blood pressure, but you can also get upper abdominal discomfort around the liver area, and that can present with cramps sometimes, but it can also be associated feelings of swelling both of the hands, the feet, and sometimes the face, headache, and feeling of general nausea and vomiting also in the combination of these symptoms. Often your obstetrician may have noted that you may have high blood pressure or other symptoms which occur at the same time of this. I hope you found this video useful, and if you like, please subscribe to our channel.